Can we start, sir?
Yeah, we can start.
Yeah. Good evening, respected professor and my dear students. I welcome you all to another session of DNB online academic activities by Raisa. Today we have the ongoing sessions, session number 8 on theory questions discussion with Professor Nagasamy sir. And today I invite Dr. Balasundaram to proceed with the first question and answer from RH Perambur. Dr. Balasundaram.
Yes, sir. Good evening, sir. Good evening,
Good
sir,
evening.
to both of you, sir. Today, my topic is crew resources, crisis resource management, sir. It is also referred to as the crew resource management. It is an effective safety strategy concept and tool adapted from the domain of aviation industry, sir. And now it has been modified to the needs of the healthcare industry, sir. So traditionally, the GABA defines crisis resource management is the ability to translate the knowledge of what needs to be done in an effective team activity in the complex and ill-structured real world of medical treatment. And crisis resource management means to coordinate, use. Hello, sir, I'm audible, sir.
Yeah, go ahead.
Sir, it is an effective means to coordinate, use, and apply of all available resources to optimally protect the patients at an individual as well as at the team level. Uh, the various resources includes all the personnels involved with skills, abilities, and attitudes, and machines, devices, and information sources, cognitive aids, and also all critical resources. It has many formulations of CRM is there, but they typically highlight situational awareness, dynamic decision making, task management, communication, and teamwork. These are the main formulations of CRM. The there are 15 key factors are there in the crisis resource management, which are first it is the first we have to know the environment, and we have to anticipate and plan. We have to call for help early, and we have to exercise the leadership and followership, and we have to at the same time we have to distribute the workload to all the followership. We have to mobilize all the available resources to the crisis environment, and effective communication in the crisis environment, and we have to use all the information available information and the sources. We have to prevent and manage the fixation errors also, and with all these things we have to check and cross check and double check the available data, and we have to fix the errors also. And 11th one is the cognitive aids, use of the cognitive aids also we have to use, and we have to repeatedly re-evaluate what is being done in that crisis environment, and with the help of a good teamwork and attention, to allocate attention also wisely to the followerships, and priority setting in a dynamical manner, we can வந்து able to uh, we can able to வந்து do a crisis resource management. First of all, know the environment. What is the know the environment? Know the environment means we have to know what is the situational awareness. We have to get familiarize ourselves by communication in that environment, and we have to inspect the place, examine the infrastructure, and knows how things work and where the things are, and we have to aware of the strength and vulnerability of the environment also. It is the main it has the ingredients of the know the environment. And second one is the anticipation and the plan. It is a second key factor in the crisis resource management. What we have to gather information and discuss in the with the team members, and we have to uh, outweigh the risk and benefits of the crisis. We have to identify the loopholes and anticipate the problems also, and we have to plan and prepare for the high workload in the crisis environment. Usually we'll be working in a low workload period, but suddenly if you want to work for a high workload period, we have to plan and prepare for that. And no now we have to head during the crisis and needs backup plan with that also. And third key factor is the call for help. In that call for help, we have to inform the we have to get help from the inform to the team members, and to the skilled peoples, and all the available resources and things. So mobilize early personals with special skills if may needed in that call for help. And leadership, followership, we have to establish a clear leadership, and we have to inform team members. We have to inform that I am the team leader, and the team leader should be actively taking part in the crisis environment, and he should be leading the crisis management. He should be stay calm and in control manner during the crisis. He has to take a firm and decision, prompt and firm decision making. Also, he should maintain a global perspective. He should not be. He should think in a big picture. So, what is happening and what to do next? And he should allow. He should want to recognize the what is meant to the leadership also by authority grants, and distribute the workload. Another key factor is distribute the workload. He should allocate the responsibilities to the co-workers according to their skill set, and he should revise the distribution if there is a task overload or failure in with the team members, by actively வந்து பெருனது monitoring in them. And we should in the distribute the workload key factors. We should வந்து establish the role clarity of the each of the team members by allocating what the person can do in the crisis environment. He or she should not want to interfere in other work, and he should not be given more work, or he should not be given less work, so that we can avoid the distraction from the team members. And other key factor is mobilizing all the available resources. Actually, in the crisis setting, we should activate all the available resources, including uh, additional personals and equipments, and we have to pre-book or the pre-order the all the resources in advance to mitigate the events and to successfully overcome the crisis. And another key factor is communicating. The communication should be a good command, and the request should be at the early also. And if you are giving some command, it should be the closed loop system. So we should not do some thin air statement, like we should not softly. We should be our communication should be bold, and we have give a good command, and the input should be very faster, and we should get the reply back also. And in the crisis period, no subordinates or no observerships or followerships should communicate on behalf of the team leaders. So if the subordinates giving any instructions or any is taking means whether it will creates unnecessary distraction. So to avoid the distractions and to smoothly overcome the crisis, no subordinates can communicate on behalf of the team member, a team leader. And other key factor is available information. We should monitor multiple streams of data informations uh, through our all the available informations, and we have to check and cross check also. And another key factor is prevent and manage fixation errors. So this is the one of the biggest key factor in the crisis resource management. So in the crisis resources, always there is a faulty re-evaluation and inadequate plan adaptations, and the loss of situational awareness will be there, and it will result in human errors also. So that is termed as the fixation errors. So the fixation errors are of three types. So first one is the cognitive tunnel visions. So cognitive tunnel vision means suppose if a patient is having if the patient is having high heart rate in the crisis situation, so it may be due to it in there will be a many causes of increase in heart rate, but we should not think when the patient is having only pain. So we should not, our perspective should be a broad spectrum perspective, and we should not think only one now. So the patient is having only pain. It can be due to hypovolemia also, or it can be some of the drugs also, drug induced also, or it can be the patient will come out from the neuromuscular blocking agents also. So our vision should not be a tunnel vision. So our vision should be a very broad and perspective vision. So this is the one of the first fixation error. And second error is வந்து இப்ப என்னது, suppose if the patient is having high heart rate and we should not particularly determined it is வந்து இப்ப என்னது only due to pain. So and we should not treat it. So at the same time we should think about all other causes and we have to check it, and then only we have to start the treatment according to that. And the third one is third fixation error is suppose if the patient is having low saturation, sorry, or low BP, and we should not வந்து tell it as everything is okay, the patient is not having because of previous BP is வந்து 110/60 or 110/70. We should check the BP at in that moment, and we should வந்து confirm it. We should not வந்து tell that the previous BP is normal, so the patient is normal. So we should avoid this type of the fixations error. So these are the three types of fixation error. First one is a cognitive tunnel vision. Second one is they will have multiple causes, but they will treat only one causes. They will tell third one is it may the scene would have happened, but they will think it has not happened. So the fixation errors is one of the main factors, and we should avoid it. The fixation factors. And the other next key factor is cognitive aids. We should be very familiar with the content, format, and location um, with that. And it helps in content, location of the crisis event, everything, so that we can effectively use all cognitive aids in overcome the crisis. And re-evaluate repeatedly, it is one of the key factors. The re-evaluate repeatedly, how we can re-evaluate repeatedly in the crisis is we should think if we stuck with some diagnosis, or if we stuck with any any time in the crisis resource, we have to think for 10 seconds for every 10 minutes. So it will, this is a principle called 10 seconds for 10 minutes principle. So when making a diagnosis, or when we are feeling stuck, we can think for 10 seconds, and we can see the environment, and we can troubleshoot, and we can plan the further treatment, or including or doing the desired sequences of action in the future. So we have to re-evaluate repeatedly, like for 10 seconds for every 10 minutes. So we can smoothly overcome this with this 10 seconds for 10 minutes principle in the re-evaluate repeatedly. And the other is good teamwork. So other use of good teamwork means we should actively engage personals involved in the teamwork, and by motivating, and by organized manner, and giving further suggestions also to the team members for actively taking part in the crisis resource also. And other key factor is allocate attention wisely. It is an it because if the patient one in the crisis period, we should not overburden a person or underburden a person. If you do both of that, the person will get distracted, or he won't do the or it will take some time to do the work. So in that we can allocate attention wisely to everyone, and we can give work to the all the people, and we can monitor the task what we have given to the person, and we can get the data, sir. So or else if the person is overloaded, we can recruit other person to help with that, to monitor him, or to do the work. So allocation of attention to a range of the task, we have to do it simultaneously with in the crisis resource management. And the last key factor is set priorities dynamically. So set priorities is arranging our assigned task in a hierarchical order according to the urgency and the relevancy. So the priorities is of three types: high priority, medium priority, and low priority. So when the crisis is happening, so we have to mm, judge the crisis. We have to ascertain the crisis, and we have to do what is needed in the first, and what is needed at the last. We should think, and we should do it, and we should complete the task, and then we have to switch over to new task. We should not get stuck up in the only one task and we should not do the task. So it is one of the it is a last key factors of the crisis resource management, sir. With the crisis resource management, there are more evidence. There are evidences for in the benefit of the CRM. So in the crisis period, in the crisis resource management, it gives if you follow those 15 key factors and we act in the following way. It gives us the provider satisfaction also. It improves us a safety culture and heightened culture of our teamwork, and increased clinical team performance also will be there, and the decreased room turnover time will be there. So we won't get stuck up in one phase of the crisis for a too long. So if we follow all the 15 key factors and we work in that, so and decreased perioperative delays and of issues and equipment issues with that. This is also one of the benefit of the CRM. And improved patient willingness also will be there. Decrease in the medication and the transfusion errors. Increased antibiotic prophylaxis complaints will be there. Increased efficiency of the clinical processes for multidisciplinary trauma teams. It is one of, and it decreases the morbidity and mortality of the patient also during the crisis. Uh, so the lagging is the crisis resource management did not have a fixed protocol like our ACLS or BLS. Now only they are gradually they are developing this crisis resource management into our clinical practices. So with that we can train, first of all we can train the PGs and we can train the senior the consultants, and then if you formulate a protocol, a devised protocol. So it will be a better tool to avoid a crisis, and we can easily manage a crisis in the future.
Next,
Hello.
have you finished Balasundaram?
Yes, sir.
Very good. Okay. Are you a primary candidate or a post DA candidate?
The post DA candidate, sir.
Post DA. Okay. Did you prepare it from Miller?
Yes, sir. Miller,
Okay.
sir.
So, being a post DA candidate, I want to ask you two questions. Have you ever
Okay.
seen a cardiac arrest happening on the table in a surgical OT?
Yes, sir.
Okay. Can you recall why it happened and how you managed that?
Sir,
What was the
recently,
case?
recently we had one crisis in our hospital like 10 days back, sir. It was placenta acreta. She was a multigravida, second gravida. She came for the history of abdominal pain to the OG OPD, sir. She
Okay.
had a abdominal pain. Suddenly she developed breathlessness and she had a tachycardia, and she had a LOC also, sir. So she became very unresponsive. So immediately they called for help. They activated the code blue, and the immediately the nearby medicine PG people went and rescued the the antenatal mother, and they brought to the theater, sir. So it was a huge hemoperitoneum. So it was the placenta accreta got attached to the bladder and other structures also. So it got that one of the vessel got ruptured, and she had a massive hemoperitoneum and she collapsed, sir, in the ward itself. So in that time, they just intubated the patient and they came and they informed to our OT teams. So that time we activated the crisis resource management. So first we called for another. So our HOD Dr. Kamachi sir he received a call from the OG HOD sir, department HOD. The HOD ma'am called our Kamachi sir, and the first thing we did he asked for the call for help earlier, and he was arranging the OT, sir, with all the available resources. So he was mobilizing many 2-3 anesthesiologists, the PGs and 2-3 anesthesiologists, and he called the general surgeon and vascular surgeon also we called. At the same time, we called the blood transfusion people also, blood bank also, to ask to activate the massive transfusion protocol also, sir. We not only the drugs, we kept everything ready, sir. Defibrillator, IV fluids, central line kits, everything we made the ready, sir. So that then only when the patient comes, we immediately started we assess the patient, and we started on one person was one person took the leader role, and was instructing other fellow colleagues
Now,
to
in this situation, one second. You said now only you are talking about the leader role.
Yes, sir.
So, who is actually the leader in this crisis situation?
VK sir was there, sir. VK sir, Dr. Kamakshi Selvan sir was there, sir.
Kamachi Selvam has assumed the role of the leadership.
Yes, sir. Yes, sir. Yes,
and
sir.
all other people were helping him. So it was
Yes,
a
sir.
teamwork. It cannot be
Yes, sir.
managed by a single person,
Yes, sir.
including the medicine PG who first saw the patient and then tried to revive the patient by immediately intubating and then bringing the whole patient
sir.
to the theater and all that.
Yes, sir.
So this sort of crisis situation requires, first of all, a good leader to guide other people, and requires a strong and effective team with
Yes, sir.
members who can understand and immediately respond to the need of the situation. Now,
Yes, sir.
here is a patient who has developed a massive hemoperitoneum and
Yes,
has
sir.
almost collapsed because of the hemorrhage and gone on
Yes,
to
sir.
even cardiac arrest. Okay.
Yes.
So our idea is to revive the patient because she is a second gravid lady. So otherwise
Yes.
she must have been quite a healthy person. So
Yes.
we must try to revive and then get the chances of survival of both the mother and the fetus as much as possible. This is our goal. So in a crisis situation, three important things. I also went through the entire chapter on crisis management in Miller.
Yes,
and it gives so many points of classification. As you said, 15 headings are being given, and it is too difficult to understand and reproduce in the examination. We are now discussing questions based on our ability to write a theory answer in a concise manner within the given 15 or 20 minutes time we have for each question.
Yes,
So
sir.
we should first of all understand the basic concepts in this topic. Like as you rightly said, this was the drill, actually cockpit drill. It was called cockpit drill in the aviation industry, where something suddenly going wrong, like a fuel getting exhausted, or a low pressure, or a cloud and unfavorable weather causing turbulence in the aeroplane, or some navigation equipment going wrong. All these things will lead to the disaster of the plane getting burst and all the passengers dying. So this crisis resource management was first conceptualized in aviation industry, which we later followed, and it is the anesthesia specialty which took up this and introduced this concept in the whole medical field. Even before cardiology, other departments started following this. It is our anesthesia specialty which gave importance to this and introduced this to the entire medical fraternity. So from this angle, we must try to make it easy to understand. So the main objects of this topic is, first of all, our goal is to revive the patient from the crisis and get a favorable result of reviving the patient and making them come back to normalcy, not having a vegetative. We can revive the heart, but there is no point if the brain has already suffered a severe hypoxia and the patient is going to be a vegetative for the rest of the life. So our aim is to get back a live patient with good back to the original level of living without any serious damage which is going to hamper the rest of the life. So with that goal, we should try to do it, and how we are going to organize and do it, that is what the whole concept of crisis resource management says. So here, to describe all the 15 subheadings that is given in Miller is very difficult, I feel, for a theory question to complete within the given time. So I found another article in the Stat Pulse, which is more concise and more easy to remember. So I'll just share that PPT with you.
Okay,
and try to describe